Hello, I am Dr. Shandu Kumari, Chief Physician and Managing Director of Mada Ayurveda Eye Hospitals at Trivandrum, Kerala. Today, I am facing you to point out something about CSR. CSR means Central Serous Retinopathy. It is an eye problem usually seen among youths. It is not a senile change or a pediatric change. Usually among youth, between 25 to 40 or 45, something like that. Okay, what is CSR? CSR is a fluid accumulation in the retinal layers. Retina is a layer, nervous layer that lies inside the eyeball posteriorly. And what is the importance of this layer? It is the most sensitive layer of the eyeball. And it is the basic point for the function of the vision. So only when the light rays converges on retina, these changes, biological changes starts. And as a result of these changes, that is chemical change, electrical change, nervous change, and all, as a result of these changes, a nerve impulse is formed. And this impulse is transmitted to the brain. And it is converted from the impulse to visual sense. Then only we get a perfect vision. So from this point we can understand that only if the retina is functioning well, only if the retina is in the good working condition, a person will get perfect vision. If there is any damage or any pathology developed on retina, the vision will be affected. So, what will be the main symptom of CSR? There will be blurring of vision. And there will be, usually what the patients say, there is a darkness in the visual field. Wherever he look, there will be a dark area, especially in the central visual field. So most often it happens all on a sudden. One fine morning, vision will be damaged. Usually they say when I was waking up in the morning, I could not see in the visual central of the vision, and I was afraid. Like that the patient says usually. So, if it is a very small level, there is a chance of absorption of the fluid leak. But in most cases, what happens? The patient will be afraid, and they will go to doctor. And after investigations, it will be diagnosed as central serous retinopathy. And doctor will say, it is need not be afraid now. Let us wait. It will subside by itself. And after some days or after some weeks, it will disappear without any medicine or without any treatment. So, but in 90% of cases, after some months, the same repeats. There will be recurrence of the same condition. At that point, they will be again going to the doctor, and the same reply they will get. Sometimes if it is serious, there are methods will be taken. Sometimes some tablets or eye drops will be given. And the main problem is recurrence. And gradually, sometimes even after waiting for weeks or months, it will not get subsided. At that point, people usually come to Ayurveda. Is there any method to avoid recurrence? Or is there anything to get my vision back? Like that. Now let us consider about the treatment of CSR in Ayurveda. Here there is no doubt it is a vascular change, and that is why the fluid is leaking. Usually the macular area, the central portion is not vascularized, but if there is vascularization, the chance of fluid leakage is more. or any other types of changes, hormone changes and vascular changes. That also is a basic reason for the CSR. So stress comes in the first point. It is a villain. Whenever there is overstress, chance of developing CSR is very high. But it is very easy to avoid stress, but it is not easy practically. Everybody is having professional stress or family or problem or financial stress is there. So what we are doing in Ayurveda is to maintain the circulation of the blood inside the eyeball, so that possibility of accumulation or leakage is avoided. In that way, we can manage it, we can control it. So for this purpose, both Indian medicines and extraocular treatment procedures are equally important. Extraocular treatment mainly are of 2-3 types. The main thing is Shirodhara. Shirodhara means it is a continuous pouring of medicine in the head region, so that the vessels will be smooth and the nervous function will be soothed, and it is very effective in my experience. So by these methods, the possibility of the accumulation is controlled by maintaining the circulation. In the second stage, treatment inside the eye also is very effective. For that, different types of eye drops and netra segam means like Shirodhara on the head, netradhara in the eye. Continuous pouring of medicine in the eye. In a scientific way, the procedure is very characteristic. Like that, applying medicine on the eyelid and filling the eye with medicated this kashaya like that in a calculated time. These are the procedures we are using. So by these types of external treatment procedures, we can manage it. Side by side, very effective Indian medicines also are there to avoid any congestion of the vessels or blockages like that. So by these two methods, we can protect your eye from CSR. And even after doing one course of treatment, and some simple methods should be continued, because the basic reason will be there. Maybe stress or lifestyle or any other types of sometimes other diseases, like sinusitis or any inflammatory conditions. So to avoid all these things, we cannot avoid that disease, but we can protect the eye from being affected from these other conditions. For this, one medicated oil or some eye drops, etc., have to be continued to prevent further attack. Like that, we can protect the eye from being affected by CSR. Thank you. All these points are shared by Dr. Shantakumari, Chief Physician of Mata Ayurveda Hospital, Trivandrum. Thank you.